Hey, what's up, y'all? It's your man G-Wade holding it down, G-Wade Podcast. And I am sitting here with another star and celebrity, a.k.a. the businessmen and women of Atlanta, doing what they do. And it's such an honor to be here at the Atlanta Medical Association. And I'm sitting here talking to Dr. Toya Clay. How are you?
Hi, I'm great. I'm doing great.
Now, you are a member of the...
I am a member.
AMA? Okay.
Yes.
Now, how long have you been a member?
7 years.
7 years, okay.
Yes.
Now, what field do you practice?
I am a child, adolescent, and adult psychiatrist.
Okay, well, that's interesting. Let's do tell. Let's hear a little bit more about that.
Psychiatry is like on the cutting edge of medicine because we're dealing with the mind.
Yeah.
And the mind is connected to the body.
Yeah.
So I think to be a psychiatrist, you really need to know all aspects of medicine. And certainly when you're working with children and families, you have to know everything from like biological problems, but also family, school.
Yeah.
You're thinking about everything that's going into what's going on with that child or family. So
Now, what are some of the and I don't know if this is anything you can necessarily tell, but what are some of the main issues that you see coming into your practice?
The most common problems that children and adolescents are dealing with would be ADHD, so attention deficit disorder. Super common, but it's tricky because a lot of kids might have a lot of reasons to have ADHD symptoms and maybe not the diagnosis. Like kids growing up in neighborhoods where they might be hearing gunshots at night.
Absolutely.
And they can't sleep. So in the next day at school, they're unable to concentrate.
Yeah.
No one's really asking what happened the night before.
Right.
And so it can be a tricky diagnosis. You really need a doctor who's thinking about the entire aspect of what's going on in their life. You need a doctor who's culturally or racially in tune with what's going on with that child and family.
Absolutely.
And then the other big one would be depression in adolescents.
Okay.
Adolescents are struggling to understand their identity, who they are in the world, what their package is. I always say, like, everybody comes in a package, right?
Right.
You might have in your package depression that you're dealing with. Someone else might have anxiety that they're dealing with. You might have this or that. But it's important to understand what your strengths and weaknesses are. Identity formation in adolescence is key. They're trying on a lot of identities.
Yeah.
So they are prone to depression because it's a confusing time, a confusing world.
Oh, yeah.
So those would be the two most popular things.
Well, how big of an influence with their depression does social media have?
Oh my goodness. It's totally changed the game.
Yeah.
Wow. I can't say as much. I would say, and I'm a parent of a teenager.
Okay.
So you want to keep them off social media for as long as possible.
Okay.
You want to take advantage of all of the parental control mechanisms. But even when you do that, your kids are being exposed to things that can influence how they're feeling about themselves. There's so much online bullying and pressure.
Yeah.
So as parents, you have to get into it. You have to be super vigilant. I think as a lot of teenagers, they want to they want to be independent. They want to do things. They think, I got the phone.
Yeah.
So I can do whatever I want to do on the phone.
Right.
So parents really have to be clear about what the boundaries are.
Yeah.
Even before they give that phone. Because if you start to you got the phone for Christmas or your birthday.
Right.
But then, you're not telling them what apps are okay or what apps are not. You're going to be behind the 8 ball.
Yeah.
And so I think it's changed the game as far as mental health providers go. Has a huge influence on your kids.
So parental control, parental supervision is highly suggested.
Highly. A must.
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 Now, you mentioned, like this children going to school, having issues at night from things that happen within their neighborhoods. Is it a thing? Are children suffer from PTSD?
Oh, of course.
Okay.
And the tricky thing about children suffering from PTSD is it might not look like your veteran coming back from the war.
Right.
It might not look like combat PTSD.
Yeah.
They might not have nightmares or flashbacks or the typical symptoms we think of. They might act it out. They might become aggressive at school.
Yeah.
They might become really reckless and impulsive. So again, it takes a really culturally sensitive doctor to understand how that manifests in children's lives.
Yeah.
Especially if it's a chronic condition. Like if a kid is living in a neighborhood where violence is common, where they're hearing police or ambulance and things like that.
Yeah.
You know, families normalize their experience.
Oh yeah, absolutely.
But that doesn't mean that that kid isn't going to have symptoms or behaviors that represent the consequences of that. You know, a lot of doctors just want to, you know, prescribe a medication.
Oh yeah, absolutely.
And they may not be able to change where that family lives, but they've got to be able to at least acknowledge it and understand it and try and bear witness to what that family is dealing with that can't be fixed with a medication.
Right. That's good. That's good. Now, how important is it for a patient, a parent with their child to walk into a practice and see a person that looks like them?
It's like living in Atlanta.
Very important.
Exactly. My son has a therapist. He's a black man.
Okay.
You know, my therapist is a black woman.
Okay.
You know, so those things are critical. It doesn't mean that that person is going to necessarily understand your unique experience as a unique individual.
Yeah.
But there are certain things that are going to be intuitive and going to be like more willing to understand, you know, that experience, especially because race has such a huge, you know, influence in our lives.
Yeah. Well, you used the word intuitive, and that's been the word. It's almost been like the theme of tonight. That intuitive, being able to identify instinctively with what that patient is going through.
Yes.
You know, I have an African American doctor, and I was just talking just a moment ago, and I was saying because I enjoy just the certain nuances that we can talk. You know, and it doesn't have to be so. I don't want to say prim and proper, but it doesn't have to be so ghetto either. But it's just
it can be all of it,
It can be all right. But we just have a way of communicating that we understand. Where it's almost like say less.
Right.
You know what I'm saying?
Say less.
Yeah.
I got you.
Yeah,
right.
I got you. Right. Yeah.
Right.
So that's important. That's really important.
Very.
Now, so if people want to find out more about Dr. Toya Clay, where do they go? Is there a social media website? Where's your practice?
Oh my goodness. I can be Googled.
Okay.
I see very few patients at this point.
Okay.
I work for a large insurance company.
Okay.
I talk to other doctors who are seeing patients, make sure that children and families are getting the care that they need and deserve.
Right.
So.
Okay. Well, it's certainly a pleasure sitting down and speaking with you on tonight. Thank you for sharing your wealth of knowledge and information with our listeners. And, you know, being a part of this organization is such a great thing.
Thank you for doing this.
This is awesome. It's your man G-Wade holding it down. G-Wade Podcast. Don't y'all go nowhere. We still in all white, y'all.